there. As we understand it, it was on when she was there in the evening late yesterday, Wednesday, that she began to feel some symptoms. She was quarantined on Air Force One. She flew back on Air Force One yesterday evening, and then it was this morning that she tested positive. Strikingly, even after, apparently, according to our sources, testing positive this morning, the president continued with his itinerary today. He traveled to a fundraiser at Bedminster, came back to the White House this evening. But notably, when he traveled to Bedminster, Brian, he traveled with a smaller team. Kayleigh McEnany, his press secretary, was not with him, nor were many of the other top advisors who would regularly travel with him. But the White House, nonetheless, this evening had put out its schedule for tomorrow. Effectively, the plan was to go ahead as it had always been. The president tomorrow was scheduled, and at least for the moment, the schedule remains that he's supposed to have a phone call specifically about vulnerable seniors, vulnerable to COVID-19. But clearly right now, there is no more vulnerable senior in America than Donald Trump himself, a 74-year-old man. He was scheduled to be traveling to another one of those rallies tomorrow in Sanford, Florida, just outside of Orlando. And then on Saturday was scheduled to have a pair of rallies in Wisconsin. Over the course of this night, Brian, I've been reaching out to many of the president's family members and aides, and they've been reluctant to say anything, having reached out to Ivanka Trump and Jared Kushner, who are traveling with the president this week, trying to find out if they had tested positive or if they have been tested or if they are self-quarantined. Reaching out to the chief of staff, Mark Meadows, who is traveling with the president as well. What is striking, given the fact that just 48 hours ago, Brian, the president was traveling to Cleveland and back, he was surrounded by a who's who of White House advisors, top Congress members, Jim Jordan of Ohio, the Republican from Ohio, among others, family members. Eric Trump was there. But, Brian, as we sort of wrap our head around this, this is a striking announcement from the president of the United States, and it comes only a matter of hours after, in that Al Smith dinner, one of these charity dinners that he was participating in, a pre-recorded set of remarks. He said that the end of the pandemic was in sight. Well, clearly the president is dealing with his own battle with this virus right now, Brian.
Peter Alexander, thank you for your reporting. And indeed, any travel schedule the White House has put out for the next couple hours or days might as well go in the shredder. I think it's safe to say this president is going nowhere for a while. To viewers of NBC programming tonight, whether you're here on the East Coast watching late night or perhaps late local news in the Mountain Time Zone or NBC primetime programming on the West, I am told that while our coverage continues on MSNBC, we may have missed the lead story, the headline at the top of this special report. It is quite simply that the President of the United States and the First Lady have both tested positive for the coronavirus. It is extraordinary on many different levels, given this president's history with managing, or many would argue mismanaging, what is still an out-of-control pandemic in our country. It is extraordinary given the fact that we are 32 days away from Election Day in this country. It's extraordinary given the fact that he was feet away from Joe Biden on a stage where they were both expelling air for a good 90 minutes just a few nights ago. Extraordinary given the circle of family, friends, aides, military, law enforcement, medical personnel who have been in and around this president's immediate circle in just the past few days. But the president of the United States, as the world, much of the world will wake up learning, has the coronavirus, has tested positive. In a statement, he said he's going to follow all the protocols. Tonight, Flotus and I, First Lady of the United States, and I tested positive for COVID-19. We will begin our quarantine and recovery process immediately. We will get through this together. The president's age, of course, puts him in one of those high-risk groups that he is fond of talking about when he, as recently as several times this week, has taken steps to indicate that, in his view, young people are way out of the danger zone. He has even been litigating, as recently as this week, the wearing of masks and mocking his opponent, Joe Biden, for doing so. That is the news we are covering here at this hour, just after 1 a.m. on the East Coast. We wanted to pass it along to all those viewers of the NBC television network Our live coverage of this developing colossal story continues all evening long on MSNBC. I'm Brian Williams, NBC News. under the heading of the press secretary, Kayleigh McEnany. It is from Sean P. Conley, the physician to the president, who also happens to be a commander in the U.S. Navy. He writes, I released the following information with the permission of President Donald J. Trump and First Lady Melania Trump. This evening, I received confirmation that both President Trump and First Lady Melania Trump have tested positive for COVID-19. The President and First Lady are both well at this time. They plan to remain at home within the White House during their convalescence. The White House medical team and I will maintain a vigilant watch, and I appreciate the support provided by some of our country's greatest medical professionals and institutions. Rest assured, I expect the President to continue carrying out his duties without disruption while recovering, and I will keep you updated on any future developments. Couple of things to point out here as this news sinks in across our country and around the world. Will we see any more presidential debates? I think it's safe to say tonight that answer is no. What of the presidential campaign for re-election of Donald Trump will we see now? Completely unknown, but any travel schedule that's been put out for the next couple of days surely will be scrapped. The president's medical condition, as we saw the doctor say, will be closely watched, closely tracked. They have superb medical facilities at the White House, but it's not speculation to say that should there be any worsening in his condition, they will waste no time and will not hesitate to get him over to Walter Reed, where they have a full medical facility available, not just, of course, to veterans of the nation's military, but traditionally to treat our presidents as well. Repeating the hour's top story, Donald Trump, through his physician and press secretary, has announced the worst possible news. He has tested positive for COVID-19. This virus still running across our country in an uncontrolled pandemic. This virus that has claimed over 200,000 lives has now left him and the First Lady with a positive test result. This news first came out tonight when we heard the news that close White House aide Hope Hicks had tested positive and was indeed feeling symptomatic with COVID-19. We have had a number of physicians and experts dealing with us and guiding us through our coverage tonight. If you were aware and watching the coverage tonight, you noticed we entered a black hole of a couple of hours after the president did a live telephone interview with Sean Hannity, mentioning that he and the First Lady were going to be tested, mentioning the people who come into contact with the president on the road and how they cannot all be policed. He then mentioned on Twitter that he was going into a quarantine process, as he called it. We surmised, he had told us he was getting tested. We surmised further that the tests were being done and done again and done again, as a positive or negative result is nothing to fool around with. Dr. Vin Gupta, ER doc from the Pacific Northwest, who we have relied on for our coverage for these many months, is with us tonight. Doc, we've just learned this news, and in the last couple of minutes, we're trying to run through everything as it occurs to us. What does this mean to the presidential election? We can go ahead and assume that presidential debates in all likelihood will now be canceled. Presidential travel will likely now be canceled. We're 30 days out. What's running through your mind as a medical professional?
Brian, good to see you again. So many things. First of all, I want to make sure that the most important thing here is that the president and the First Lady and everybody that might have been exposed, Hope Hicks, that they're doing okay. And so I'm glad to hear that it sounds like they're doing okay. Hope Hicks, I'd like to better understand what her symptom profile is. Having said all that, this raises the specter of when did Hope Hicks actually come down with COVID-19? When was she displaying symptoms? And let's retrace the steps then of her actions. Where was she? Because this is bigger than just the president, the first lady, their inner circle on Air Force One, every one of whom now must be quarantined, requisite 14 days, regardless of what the test shows. I'd want them to be quarantined for 10 to 14 days because this is a high risk exposure. Brian, we were talking about this 45 minutes ago before the president's test came back positive. So that's number one. Let's retrace the steps because it's critical to do that for a few reasons. Did the vice president's team and everybody in Case Western, were they exposed? Because it's not hard to turn back the tape and say, my goodness, if Hope Hicks was symptomatic on Wednesday, say morning or afternoon, people, especially young people, go through a phase where they're what we call pre-symptomatic. And that can be for a period of time, 24 hours. Who knows? It's uncertain based on the individual. They can be pre-symptomatic, but infectious to others after they've been exposed. So you get exposed, then the virus incubates for as short as potentially 24 hours. And then you're maybe pre-symptomatic for who knows how long before you develop symptoms, if you develop symptoms. So Hope Hicks, if she was close to the president on the day of the debate, this changes the ballgame in terms of what the vice president's team should be doing. And then finally, I'll say, Brian, if the president's team knew that Hope Hicks was positive and that they were all in close contact with her, why did he go to an event today and willingly, volitionally, frankly, expose other individuals at a fundraiser? To me, I don't understand that. What's the medical advice that he's getting from Dr. Connolly and others? Who is encouraging him to do that? Because at that moment, when Hope Hicks turns up positive and symptomatic, that should have raised alarm bells and a 5-alarm fire that everybody should shelter in place until we get testing. And then even then, we should repeat testing over a period of time. So this is a big deal.
Doctor, what's our assurance, and I guess absent facts and a fuller statement from the White House, we have none. What's our assurance? Are we just assuming that Hope Hicks was the person, the means of transmission to the president, given the ground he has covered, all those he has come in contact with?
It's a great point. We're flying blind to her, Brian. Who knows? That's the simple question. Maybe Hope Hicks was exposed to somebody from somebody at a rally or from another staffer. And then just because of her high profile, it's been identified that she's now COVID positive with symptoms. It's unclear. We have no idea, which is why everybody in their inner circle must be quarantined and tested. I'm not saying it for any other benefit than their own health and the health of their loved ones, number one. But then we need to identify and do a massive contact tracing effort to see who they may have exposed, in addition to the vice president's team, each of their families, because their families were in that enclosed space. This changes everything. But yes, the presidential race has been fundamentally altered tonight. There should be no more in-person gatherings for the remainder of the season. And my biggest concern here is if the president remains asymptomatic, that he may use it to tamp down the seriousness of the infection. Because let's be clear here. Let's hope everybody stays well and healthy. But this was preventable. They were not wearing masks per report on the flight. They've been saying mocking masks in some cases. The fact that this even occurred is a damning indictment and unfortunately kind of a we told you so reality based on their months and months of misrepresenting good public health practice. I mean, this was avoidable. This did not have to happen if they were practicing the proper procedures and not going to these rallies and having these chaotic events where, of course, airborne exposure was going to happen, even if it was in an outdoor setting. No masking, no distancing. What did they expect was going to happen?
Doctor, to your point that this hour calls for plain language and clear thinking, the president has been fond of saying that this is mostly concentrated on the risk group of senior citizens. In fact, tomorrow, back when life was normal, he had a White House event, a kind of conference call on the topic of impact in the senior citizen community. Well, guess what? He's a senior citizen. He happens to be the oldest president to hold the office in our history thus far. Talk about that. Talk about things like comorbidities, a term of art from your business.
You bet. You bet. What we know, there's two independent risk factors for a bad outcome if you have COVID-19. One is age. So if you're older, that's a risk factor if you're infected with the virus to end up, unfortunately, in an ICU and see somebody like me. You don't want to see somebody like me in a hospital, and that's the risk factor. If you're, say, 65 and older, that's a high-risk group. Add on top, let's speak plainly about the president's medical history as we know it, not as the Surgeon General describes it, which is perfect, or as Dr. Connolly describes it as perfect. His BMI is elevated, meaning he is obese, overweight, whatever word we want to describe. That, in addition to who knows what else might be present. There's been concerns about his fitness when he walks down a set of stairs. I don't want to speculate on what might be or what may not be occurring, but at the very least, he has a significant comorbidity, a risk factor in addition to his age, which is being overweight. The combination of the two, I've cared for several patients in the ICU who have that double whammy. They're older and they're overweight. If patients develop COVID-19 and they have and unfortunately they have a bad trajectory, meaning they start developing shortness of breath or a cough or fever, and then they need to come into a hospital. These are individuals that tend not to do well. So this is a very serious situation for the president. I'm glad Dr. Connolly mentioned he'll be very vigilant. He needs the top experts that are in DC to watch him closely. He's the president, after all, regardless of whomever's politics. He's our president at this moment. We all wish him well. But part of this is him hopefully being humble enough to acknowledge that perhaps the way he's been behaving and messaging has been wrong, and now he's unfortunately bearing the brunt of that consequence, which is not practicing good public health interventions like masking distancing. He's paying a price now. He's now having to quarantine. Hopefully, he remains asymptomatic, but yes, he is at risk for a bad outcome. Absolutely, Brian.
Dr. Vin Gupta, can't tell you how fortunate we are yet again tonight, especially when this story has taken such an important and potentially nation-changing turn, to have your expertise and your calm. And I speak on behalf of the national audience watching this story right now. Thank you. Andrea Mitchell is our veteran chief foreign affairs correspondent. Of course, the host each day of Andrea Mitchell Reports on MSNBC. Andrea, none of this is about us, but I'm remembering taking over for you as White House correspondent in, 1995. Between us, we've seen a few things. Never anything like this. Talk about where this leaves this president, our country, and the presidential race with the whole world watching.
It's a devastating outcome for the president personally, so that is the first thing we have to think about, because no matter how asymptomatic he may be right now, and the First Lady, of course, we have to, as Dr. Gupta just pointed out, worry about his age, his other comorbidity factors. We've not had a real medical report from this president. Unlike previous presidents, this is the first president we have not had a full medical report, a really transparent disclosure, and we have not had a full medical report even when he was candidate Donald Trump. Remember all the controversies over that and the controversies over his first physician, Ronnie Jackson. So those are concerns. We really don't know what the baseline here is. And there is the foreign policy and domestic policy and the election campaign. I mean, it's a confluence of things. So we note that Boris Johnson and other leaders other heads of state have had the COVID and have survived wonderfully from it. But there is also the long-term effects, and that's another thing that is not well understood even by the scientists who are studying this disease. Match that, of course, with the president's own past history on COVID, calling it a hoax, denying it, downplaying it, the Bob Woodward reporting, all of the reporting, the conflicts with Dr. Fauci, with Dr. Redfield, the other members of the White House task force, downplaying them, listening to Scott Atlas, the radiologist who is not a public health or virologist expert and who has been largely discredited and criticized from within the task force, among the others, from all of our reporting, the disclosures, the whistleblowing report from Olivia Troy that broke first on the Washington Post and then on NBC and MSNBC, all of this information showing how much he has discredited and disputed and pressured the doctors, the experts around him, and undermined the FDA, the CDC, and the others who have tried to help the American people with their warnings, as recently as today with Hallie Jackson, Admiral Giroir, saying, wear a mask, wash your hands, avoid, make sure you social distancing, avoid indoor locations. With the governor of Wisconsin just today again, and other officials there arguing that he should not come to two events that were scheduled for Saturday, with Wisconsin one of the worst hotspots right now in the country. So all of this, the trajectory of, all the people who have now died, more than 200,000 people who have died, 7 million plus who have had this disease here alone in the United States. And a lot of this, of course, attributed to the handling of this by the White House and the president's skepticism early on and his continuing arguments with the public health experts. That is all wrapped up in an election campaign. As you know better than anyone, Brian, we're 33 days away from the election, 32 days, I guess. We're past midnight now. And this is about as big a domestic and international crisis as I can remember. And you refer back, I remember standing, at Bethesda Naval when the head of the National Cancer Institute announced that President Reagan had cancer, colon cancer at the time, and it was a national crisis. I remember covering the assassination attempt against President Reagan. Anytime a president of the United States is ill, obviously the 1981 assassination attempt was the worst that I've ever covered. That's a crisis for the country. We all pull together. We all hope for the very best. It becomes, especially in this day and age, and with this president, given all of his skepticism about COVID-19, Brian, and the way he's handled it, and the Tulsa rally, he again was disputing just the other day. Last night, Wednesday night, he was in Minnesota with no social distancing. At the debate on Tuesday night, there was, according to Monica Alba of our team, who was there as one of the pool reporters, there was an incident where someone from the Cleveland Clinic in a white lab coat approached the White House team, who had taken off their masks and while they were being seated, and tried to approach at least somebody in the party to get them to wear masks, and then backed off. So did not have an interaction with anybody, with the First Family and anyone in that group. But the president and the entire First Family were there, and we all saw them without masks. Certainly the president on the stage was not supposed to be wearing a mask. He and Joe Biden were not, and nor Chris Wallace, the moderator. But the people in the audience had been encouraged to wear masks even while they were seated. And there was no social distancing among the people in the president's party in that front row. So there were so many questions being asked about all the people in Minnesota who were at that rally. Obviously, it's an outdoor rally, but there were people, there were greeters at the airport, there was a lot of handshaking. And we've seen a lot of handshaking in the White House recently, at White House events, at all kinds of events with people, including the vice president and his team, all shaking hands, members of the cabinet. So very little effort to observe or even model the behavior that the public health officials have been advising. Brian?
Andrea Mitchell, covering the scope of this, answering all our questions. Thank you for your coverage and your calm at this hour. I'm told the First Lady has tweeted something for her part on social media. I've not seen this. Too many Americans have done this year. The President and I are quarantining at home after testing positive for COVID-19. We are feeling good, and I have postponed all upcoming engagements. Please be sure you are staying safe, and we will all get through this together. Melania Trump on Twitter just in the last few minutes. Hallie Jackson, among our White House correspondents, has been strenuously working the phones and reporting this out. Hallie, there's so many different ways to approach this. Obviously, first and foremost, before any conversation at this hour, we're concerned for the human beings involved, the health and safety of the president, First Lady Hope Hicks, anyone else who may be on a CDC rapid call list tonight of contact tracing, given the huge number of people come in contact with at least these three. But what else have you gathered?
You're right, Brian. There are a number of people who have come into contact with the president, and I don't want to skip over the first point that you made, because you're right. This is incredibly serious and about the health of the leader of the country, his wife, top of at least one top official that we know of. I will tell you that we are out to the vice president's office for their response or statement, as well as to the Trump campaign on this, because there are a lot of questions about sort of where this goes next, what happens from here. You alluded to the idea that there will be some contact tracing done, and I can tell you that that is the expectation among at least some people inside the White House. Remember, the president had interactions today with a number of people, a number of his staff members. I'm not sure if the video that we're showing which day that is from, but I can tell you that today the president was on Marine One, Air Force One up at Bedminster, his resort up in New Jersey, for a fundraising event with others as well. So he was around a number of people. He came into contact with a number of people. I can tell you that he will be working from the residence. The First Lady, as you read in that tweet, alluded to that as well. She says that she is feeling fine right now, as is her husband, I should say. But at this point, again, the question is medically, and this is another thing we're trying to pin down here, what is the treatment for the president should he get to the point where he needs treatment? Again, she says, the First Lady, as you're looking on the screen right now, says she is feeling good, that they are both feeling good. The doctor, Dr. Conley, the White House physician, says that as well. But at what point do they need to make sure that there are some treatments or therapeutics in place for that? As far as the president's schedule, you have to imagine, Brian, and we'll get some clarity on this, you don't see how he gets on a plane anytime soon, frankly. And he is somebody who had a lot of travel, who had a lot of campaign travel that was intensifying, as we are now just 32 days out from the election. And at this point, it looks as though all of that is changing. There are question marks about the people that he's come in contact with over the last couple of days as well. You were talking to our medical expert just earlier in this special report. Keep in mind that it was just on Tuesday, Brian, so it was just, I think, 48 hours ago, maybe 52 hours ago at this point, that the president was wrapping up the debate and getting on his plane, flying back here to Washington with his entire family, all of his adult children on that plane on Air Force One. There's a list of about 20 people that we've identified who were traveling on that plane with the president. I can tell you one of them, a member of Congress, Congressman Jim Jordan, a Republican aide, says that Jordan was told that he did not need to quarantine, or is not planning to quarantine, I should say. This is after we reached out to the Hill folks there, after we learned that Hope Hicks had tested positive as well. And you're seeing some people who recently traveled with Hope. And of course, you have to add that now. That graphic could change to people who recently traveled with President Trump and First Lady Melania Trump as well. East Wing staff, you have to remember that there is a West Wing staff, but Melania Trump has her own staff as well that she is in close contact with, including former Press Secretary Stephanie Grisham, who is now her chief of staff. So again, the domino effect is real here. And there are tentacles that extend through the West Wing and the East Wing. And so these are some of the questions that we're working on tonight, and some of the facts that we know as we are continuing, of course, to work on this. Listen, what time is it, Brian? It's 1:45, right, in the morning? Everybody's awake. Nobody is asleep. And I think that tells you something, too.
It does. Hallie Jackson, White House correspondent, thank you for your reporting. Turning that around on a dime tonight, Dr. Erwin Redliner, based in Columbia University in New York, remains with us and part of our coverage. And Doc, as we keep saying, obviously, our thoughts are on the health and safety of the humans involved in this, two of whom happen to be President and First Lady of the United States. Am I correct in assuming, Doctor, that the very best outcome is convalescing at the White House, that should we ever see a helicopter flight from the White House to Walter Reed, that would be a bad indicator of the president and how he's faring with this?
It certainly would be, Brian. And this is a very, very complicated situation. First of all, as my colleague Dr. Gupta was saying earlier, the massive amount of contact tracing that has to happen now is overwhelming, and I'm assuming they'll have the resources to do that. But there's a few other pieces of information that we need to know. First of all, there's been controversy about how this virus is actually transmitted and how long it lingers in the air. This is the controversy about whether the virus can be aerosolized, and most scientists think it can be. And what that means is that the 6-foot distance that we want people to keep is the general population recommendation. But we might have a much longer, much wider much wider area that could be infected, could be having the virus in it. That means that people who may have been farther away than 6 feet would still be in jeopardy. And I'm thinking of the debate with Vice President Joe Biden, could also himself be in danger. Everybody's going to need to get tested, including Biden and his people. And to that point, I don't see how we're going to have another presidential debate anytime in the next few weeks, actually. I think those are over, unless they figure out something to do on a Zoom platform or something of that nature. I think that all of the normal campaign activities are going to come to a halt right now. The president cannot move out of the residence, neither can Melania, and neither can all the other entourage that now have to be quarantined for 14 days. I'm very concerned that Hope Hicks had symptoms at least a couple of days ago at this point, and why the president didn't get tested immediately is befuddling to me. And I think this is representing a level of, less responsibility on the White House medical staff than I would have expected. That should have, Hope Hicks having any symptoms should have required immediately testing. She may have been infective for, since September 15th or 16th. And this would have, should have raised the alarms in a much louder way than apparently it had. And unfortunately, the president is potentially extremely vulnerable to being extremely sick, as my colleagues have said. And that means that we have serious national security concerns that are the result of having a president who actually may be sick enough to be unable to fulfill his functions as president. And then we turn to the vice president, who also may have been exposed in ways that are going to have to be figured out like immediately. I'm assuming all the vice president's staff are being tested right now as well. Brian.
Yeah, there is interplay among aides between the two. There is interplay among staff, among Secret Service. You invoked his name. Dr. Vengupta remains with our coverage. Doctor, I hesitate to mix politics and medicine, but sitting here listening to our coverage, I'm reminded the three most prominent world leaders known to have coronavirus, Brazil, UK, and US, have one theme between them. They were all coronavirus deniers.
Yeah, Brian, I mean, that's unfortunately a horrible common denominator that I'm sure if you ask the leaders of those three countries, they probably wouldn't want to be a part of that affiliation, that group. Everything that Dr. Redlener was saying, I couldn't agree with more. One of the big concerns I've had is parents, teachers, people, college students wanting to go home if they're on campus for the holidays, ask me hey, doc, how do we go home safely? Can we get on a flight? And the answer to them is, and I'm going to show some props here, Brian, because I think it's important to make this real. The answer is the way to make it as safe as possible is you need a high quality mask. And we may disagree. I have healthy disagreements with my own colleagues about, is that an N95? Is that something different? But a high quality, well-fitting mask, and then a rapid point of care test like the one I have in front of me, it's a high quality test. If what we're saying happened with Hope Hicks, or whomever was the incident case, is that they subscribe to the best practices, and in spite of that, she still exposed the president, or somebody exposed the president, and now all of these dominoes have since fallen. That is what's concerning, because the American people need to know in clear terms, how did this happen? Because that will impact holiday travel. Right now, we're trying to figure out potentially, okay, under these set of circumstances, you can go visit grandma and grandpa, or you can go home to see mom and dad. But if she subscribed to best practice, and I doubt it based on what I've seen publicly, than when she's not in flight at 30,000 feet. If she was, it's important for us to know that, because it is absolutely vital that we understand the parameters of this positive case. So I hope there is not happy talk. I hope there is not skirting of details. I hope they overshare information. So that's vital. And then, and just the question Haley had mentioned, the vigilance on the president. We all want the president to be healthy and safe. We can disagree with his tone, with his mixed messaging. We don't want anything adverse to happen to him. Here's the thing. This is what I'm sure that his physicians will be monitoring: a pulse oximeter. This is one of these guys where if you've been in a hospital, you put a pulse oximeter. This measures your oxygen level on your finger. I'm sure they're going to look at what his oxygen level is. If that's declining, there's some sense that maybe oxygen levels or some type of pneumonia early on in the lungs, basically an infection of the lungs, might precede symptoms. So they'll be looking for these sentinel signs early. Is the president becoming symptomatic? Is he at risk of becoming symptomatic because his oxygen level is really low? They'll be doing the same thing for the first lady. So that's what vigilance looks like. To be really clear, and Haley was mentioning therapeutics, there isn't a single therapeutic that is available to prevent progression of COVID-19. The only therapeutic that works to save lives is a steroid called dexamethasone, but that's for individuals that are on ventilators, critically ill. We know that can save lives once you're that critically ill. But there's nothing the president can take preemptively that we know can work to prevent progression of the virus and potentially causing the onset of symptoms. Nothing, not hydroxychloroquine, nothing that he has talked about. So it's vital to understand that this is basically, there's a lot of uncertainty. Let's hope he pulls through. Let's hope nothing happens. But let's also hope he uses this opportunity to maybe actually start again when it comes to messaging and encourage everybody to be taking this virus very seriously. What I hope he doesn't do is take the next 10 days, if he remains asymptomatic, to minimize the virus. That's a concern I have, is if he remains asymptomatic, will he minimize the significance of this virus? I hope he doesn't do that.
Dr. Vin Gupta, wow, thank you for that. That was comprehensive. Jonathan Lemire remains with us, having made his reporting rounds. Jonathan, I'm trying to fast forward into the realm of the unknown. If campaigning were to somehow miraculously resume, think of what percentage of his argument this takes away. This week, at a lectern opposite Joe Biden on stage, he took personal credit for Big Ten football coming back. This week, he repeated the false claim that in democratically run cities and states, they would reopen schools and the economy the day after the election because closing down surely must be a political act and not related to the pandemic. It's been the thrust of his message, as no one needs to remind you.
Brian, we have seen other foreign leaders contract the coronavirus. We know that others in the White House, including his national security advisor and other close aides, his son, Donald Trump Jr.'s girlfriend, have all contracted COVID-19. So we've had to consider the possibility that someday the President of the United States may come down with the coronavirus. We've been doing that for months. But now that it's here, it's almost unfathomable what this means. And you're right, it completely upends everything the president has said on the virus this entire time. Let's recall, of course, that he was almost a denier of the pandemic early on, that he was slow to wear a mask and now still rarely does, that he would say repeatedly that it would not affect children, that he's touted therapeutic drugs that were later proven to not be helpful and perhaps even harmful. He has time and again denied the seriousness of the pandemic, suggested that the nation was rounding the corner and in its last legs with this, battling this virus, flying in the face of science, and been wrong over and over. And now, of course, he has contracted it. And the questions are, what comes next? Will he actually fall ill and develop symptoms. As been discussed by the excellent medical guests, he is in a very high-risk demographic, being in his 70s and overweight. Will he, perhaps, if he does shake it off, downplay its severity, which of course would be very dangerous indeed? Does he attempt to resume campaigning once this period is over, assuming he does make a recovery? What does that look like? Are his supporters still going to want to hear him talk about the virus after he had just contracted it? Could there be another presidential debate? That remains highly unknown and potentially unlikely, considering what we have seen. There's going to have to be a massive contact tracing effort done among White House staff, among other officials that the president has come into contact with. I'll mention just one or two now. He, of course, just a few days ago, spent time with his Supreme Court nominee, Justice Amy Coney Barrett. His chief of staff, Mark Meadows, who of course is in very close contact with the president all the time, also much more recently, just in the last day or so, spent time with Justice Barrett, potentially Justice Barrett, with Judge Barrett. Will they now also need to quarantine? If so, what happens to Supreme Court hearings? Do those get postponed? Is that still going to possibly happen, rush through before the election? What will we have any sort of semblance of regular campaign events the rest of the way? These are things we simply don't know and won't know for a while. What we do know, Brian, as a final point, the president has indeed canceled all of his campaign travel tomorrow. His trip to Florida is off. His fundraiser in Washington is off. The one event that does remain, he's still going to have, from the White House residence now, a call with vulnerable COVID-19 seniors, of course, which he is now one. He has contracted the virus. Beyond that, remains to be seen. But we have certainly stepped into the unknown here, Brian. It's safe to say this. We have never been here before.
No, we haven't. And safe to repeat something we said earlier in our coverage, the whole world is watching. And the whole world, of course, has paid such a colossal price in light of this yet uncontrolled pandemic, Jonathan. The president has been, among other things, kind of teasing out the possibility of a vaccine before Election Day. Your story today and tonight, Jonathan Lemire was about the head of Pfizer, questioning the president's timeline, assuring his customers, stockholders, employees, general public that he was going to adhere to his own timeline. Indeed, as you were talking, Jonathan, we put up the headline from our colleagues over at CNBC. This was bound to happen, and financial markets react this way, but Dow futures down heavily, 500 points. That was one of the markers the president has been reaching for, even to his rally audiences, even to audiences who have natural reason to wonder, what does the stock market have to do with me? President's been touting used car sales. So eager was he to find stats that spoke to the recovery that he has been promising. This will now, Jonathan, focus so much more attention on the virulent nature of this virus that I think it'll be a setback overall for the messaging he has tried to push, if you leave aside his private comments on the phone to Bob Woodward.
It's hard to imagine otherwise, Brian. Certainly the president, as you said, has been trying to tout economic indicators to show a sign of recovery, of growth, that things can go back to where they were before the pandemic. That still remains his central argument for re-election, is that he grew this economy once, in his words, and he can do it again. That indeed may take a hit here. And it's also going to, as you indicated, put much more scrutiny on the process to develop a vaccine. There will be that much more pressure now for this, from this White House, to have a good news story. We've been talking about, we've had no shortage of October surprises. Some arrived before the calendar flipped to October in the form of Justice Ginsburg's death. And now, of course, we are in the early hours of October with the president's COVID-19 diagnosis. This is a White House that's going to desperately need a good news story again after what has happened. Certainly the president has made clear he hopes and expects a vaccine to be out soon. So that was my story today is we were able to obtain a memo, as you said, written by the CEO of Pfizer to his employees and staff members and stockholders, saying that he was very deeply disappointed that the development of a vaccine became such a political football in the debate 2 nights ago between Joe Biden and Donald Trump. And he was reassuring them that the company, which is one of those, of course, pushing a vaccine, is considered to be one of the closest to developing one, but would not bow to pressure from anyone to do so, that they would stick to the science and would not cave to any sort of political push. And though he did not single out President Trump by name for that part of his memo, it's clear that the president, of course, has for months now said and offered accelerated timetables for a vaccine, suggesting that it could be ready, by perhaps Election Day. And certainly his staffers want that to happen. They feel like that is perhaps the last ace up their sleeves to change the course of this election. And as a final point, this is obviously a health crisis. Everyone in America wishes the president and the first lady to recover, and certainly the world will indeed be watching. But we are just a shade over a month until the election, and that is going to color, this diagnosis is going to color this final stretch run in extraordinary and I'm sure unpredictable ways.
Oh, it sure will. Jonathan Lemire, thank you for your input into our coverage. Back to Dr. Erwin Redlener we go. Doc, it has occurred to me there is no 3-ring loose leaf binder to refer to on where to go from here. Like snowflakes, no two patients, no two cases are alike. Dr. Gupta was talking about the oximeter, which certainly will be an early indicator and among the monitoring tools, but we're still in kind of uncharted territory, aren't we, other than the fact that he will be monitored every moment from now on?
Yeah, it's totally uncharted territory. Brian, it's also ironic that the president, according to the tapes made by Bob Woodward and just released, he knew forever, basically, that this was a very serious, horrible problem that was going to harm a lot of Americans, a lot of people around the world. And those words are coming true in his own case right now. And ironically, his public statements and information he's been giving out have been exactly the opposite. So he's been, in a sense, the poster child for a mismessaging that has not only cost so many American lives right now, but it's also put himself in great jeopardy, as his family is now in, as well as all of these countless numbers of people who have been in proximity with the President of the United States. The other thing is, Jonathan was talking about the impact on the election. And, whatever was left of any sense of normalcy of a presidential campaign a couple of days ago has now completely evaporated. And we're going to have some kind of campaign, some sort of messaging, I presume. But as I said earlier, there will not be, I don't see how we could possibly justify any kind of debates at all unless they're on some sort of Zoom-like platform. And we're going to have who knows what if God forbid, the president actually gets sick or very sick, which is entirely possible from the coronavirus. So we have our world in topsy-turvy right now. And I want to talk also just to mention, you had a guest on an hour or two ago that was talking about the national security consequences of having a president who's ill. And this has been the case with every single incident of a president, whether it's Ronald Reagan or anybody else, getting sick while they're in office and trying to run the country and be the leader of the free world. This puts the United States in a very unusually difficult circumstance in terms of the many, many foreign policy issues and national security issues, which are always on the president's plate. So this could not be more complicated, Brian. But from the medical point of view, yes, he's going to have to be monitored like to the max that we're able to monitor. But it's worth repeating what Dr. Gupta said, which is that there is nothing that can be given to the president to either avoid or ameliorate any possible serious illness or complication from this. And hopefully he won't need the kind of medicines like dexamethasone or remdesivir, which are reserved for very sick people in the hospitals. Hopefully he won't get to that point. But there's nothing that we can give him to slow that down if that's going to be the inevitable fate right now, Brian?
It will be, sadly, a topic at the Pentagon, and don't think for a second this isn't a national security matter, as the doctor points out correctly. It certainly is that, and very much a human story unfolding in the residence portion of the White House tonight, where the president and first lady have begun the countdown, the period of treatment and hoped for convalescence after both of them tonight have tested positive for the coronavirus. For now, that's going to wrap up our live coverage. For those watching us on the television stations of the NBC television network across the country and around the world, it will obviously continue. Live coverage will on today, tomorrow morning on NBC. Complete coverage throughout the day. Live coverage continues all night into the morning this Friday morning East Coast time on MSNBC. For now, I'm Brian Williams, NBC News. Ali Velshi will continue our coverage after this.